The psychedelic drugs were introduced in modern psychiatry way back in the 1950s and 60s. Really, they were part of a tradition of trying to understand how brain neurotransmitters work. And they were very powerful tools. And they were showing very, very interesting success. But they got caught up in the cultural warfare of the 60s and the war on drugs. And this happens in science, and particularly in pharmacology, and particularly in anything dealing with addiction or mental health. So for 20 years, the science stopped of psychedelics, except perhaps in the underground, where it really doesn't belong. It belongs where it can be looked at, where it can be evaluated, where the FDA can do studies, and that is exactly what's happening today. And at Recovery Without Walls, we're trying to tune in to where can we use these tools very carefully, very consciously, and we are part of a new movement to use the drug ketamine in a very careful way that has some psychedelic benefits. And this is called ketamine-assisted psychotherapy, which is an off-label and legal use of ketamine, which is growing around the country. And we at Recovery Without Walls have started to very carefully introduce it with connections with the nation's top researchers in this field, so that we're informed by the best practices as we move forward on that. In the future, psilocybin, for example, is being studied in many of the top medical centers of the world and in Europe and the United States. And the drug MDMA, which is also called ecstasy, is actually being studied for the treatment of post-traumatic stress disorder, including in veterans of the Iraq War and other severely traumatized individuals. It seems to be the most effective tool. We're not ready to use it yet. We will wait for FDA approval. We will wait to follow all the guidelines. But when these new tools are available, because of our connections with many of the researchers, we will be in a position to introduce them in a very efficient and appropriate way.